The most beneficial aspect of this bill is as follows. If you don't like Obamacare, who do you complain to? You can complain to me, but I sure as hell don't run it. If I can get South Carolina in charge of this money that would have been spent in Washington by a bureaucrat who's unelected, I promise every South Carolinian the following. If you don't like your health care, somebody will listen to you. It's your governor and your state house representative. You can go to the state house representative who most likely goes to the same hospital you do. You can go to your governor who will listen to you because they care about your vote, if nothing else. I'm trying to take the money and power in Washington and send it back closer to the patient. If you believe government closer to the people is the best government, why not health care? And finally, we know how this movie ends if we don't change. We're going to have a single-payer health care system in this country that's going to bust the budget, and we're going to start rationing care like you've never seen. Obamacare is failing for a reason. It's a bad idea. State control of health care will work because the people in charge will be accountable to you, unlike Obamacare, where the person in charge could give a damn of what you think.
Bill?
For 25 years, I treated patients in Louisiana's charity hospital system. It's been my life's work to try and bring health care and coverage to those who do not have. So when a fellow back home named Moon Griffon with a special needs child tells me that he's paying over $40,000 a year in premiums, plus a $5,000 deductible and more money on top of that, we know that the system is failing. I've spoken of the Jimmy Kimmel test, where those who had need would have their needs addressed. His family, Moon Griffon, it's almost beyond their reach. He has a job, doesn't get a subsidy, and therefore cannot afford his insurance coverage. That's not the way it should be. What we attempt to do is to take all the dollars that are here in Washington, D.C., doled out if the state jumps through a hoop, and we return it down to the states for the states to do that which is best for that state. If you're in a state which has not expanded Medicaid, you're going to do great. And all those lower-income Texans, Floridians, Mainers, Virginians, Missourians will have dollars in their state to help them get health insurance that they currently do not have. If you're a state which has expanded Medicaid, we do our best to hold you harmless. We don't want to hurt folks. We run it through the CHIP program. I hear no one complain about the CHIP program. The CHIP program is something on a bipartisan basis, has been recognized to be an effective way to provide access to quality care to those in need. We take it through the CHIP program. We continue patient protections. Whatever waiver a state wishes to have, they must ensure the Secretary that they continue to provide adequate and affordable coverage for those with pre-existing conditions. That is our backstop. We preserve mental health parity, but ultimately we give the dollars to the state for the state to be inventive. We can look at the things that states have done over the last 10 years, some of which were squashed by Obamacare. In Maine, their invisible high-risk pool, which Obamacare put out of business, lowered premiums by 20%, is now seen as the policy to go forward. In Indiana, where they pre-funded health savings accounts so lower-income Hoosiers could be empowered to purchase their own services, they found that costs went down and outcomes improved. We give it to the states. I'll finish how I started. I'm a doctor for 25 years, caring for those who didn't have coverage. It is my goal to continue to bring them coverage. I think that Graham-Cassidy, Heller Johnson does a far better job for this than status quo. Thank you.
Any questions on the substance? I'd like for Senator Cassidy and Senator Graham to handle.
Senator Graham, can you talk about and/or Senator Cassidy? You said you've never been in a better state with this as before. You know that almost any repeal replace plan, however it's packaged, is going to get anywhere between 46, 47 Republican yeses. We might be a little higher than that now, but that's not that much better. Why is that different than July when the math fundamentally to this moment hasn't changed?
Well, at the end of the day, we need 50 votes, and if you're a Republican, chances are you believe in federalism, because if you don't, you probably are not a Republican. So the last effort to repeal and replace Obamacare was better than Obamacare, but it did not embrace the concept that Bill is talking about. So I believe that most Republicans like the idea of state-controlled health care versus Washington, D.C. controlled health care. Employer assessments are going out next month. By the end of 2017, over 90,000 businesses will get a notice from the federal government under Obamacare that's $4.8 billion. A lot of Republicans would like to stop that from happening, and the best way to do that is to repeal the employer mandate, individual mandate nationally. States can reimpose it. So we've come upon an idea that is uniquely Republican, but over time has proved to work in other areas like welfare reform. So I would hate to be the Democrat that voted against more money for my state and more power and keep the status quo. So if you're a Democrat, let's say in Missouri, you're going to get far more money under this proposal than Obamacare, and your state would have more control over the money. To reject that money and that control means you believe that somebody in Washington cares more about people in Missouri than people in Missouri. You believe it's okay to help California, New York, Maryland, and Massachusetts more than Missouri. That's just what a Democrat would have to face if they voted no. If you're a Republican and you vote against federalism, you got to explain to people back home why Washington knows better. And almost every state except the 4 I've described do very well under this new approach to taking the money out of Washington. So I think the idea is more powerful. I think the substance is much more fair. And at the end of the day, I really believe we're going to get 50 Republican votes, and I make a prediction. There are going to be a lot of Democrats struggling with a no vote, because at least 8 of them, their states do far better than Obamacare in terms of funding, and they have more control over the money, and that's going to be a hard no.
Is it not a bit reckless to pass such a monumental bill without the CBO's full appraisal on its impact?
The CBOs told us that they'll have a score for us. The coverage, that'll be on the cash aspect of it, the financial aspect of it, so we'll have a chance to look at that.
Senator Graham, when is the bill coming to the floor?
Well, you all understand that we would have to deal with this before September the 30th. And so that's the answer. You know, we'll have to deal with it because the vehicle expires at the end of the month.
So does the matter bring this bill to the floor, to be clear?
If we were going to go forward, we would have to act before September 30th.
You haven't decided whether you will.
Well, we are in the process of discussing all of this. Everybody knows that the opportunity expires at the end of the month.
Can I say something about that?
Yeah, go ahead.
Okay. Here's the test for Republicans. Did we work as hard to repeal Obamacare as they did to pass it? Mitch McConnell and the leadership has done everything we've asked and then some. I spoke to Paul Ryan, the Speaker of the House, and says, I like it, you send it to the House, it's going to pass. Every Republican out there believes that this is a fundamental reason we're in charge, that Democrats have lost a lot of seats backing a bad idea, and we've been the biggest political beneficiary of Obamacare, and we want to try to make patients the beneficiary of our idea. So at the end of the day, will we try again? I would argue that yes, we should, because I do not want to go back to South Carolina and say that I did everything I could to repeal Obamacare and not believe it in my heart. So Senator McConnell is doing everything he can. Paul Ryan told me to my face, if you pass it, we pass it.
Leader McConnell, this plan has been out there for a couple of months. How do you convince Americans that you truly think that this would lead to better health care and it's not just a last-ditch attempt to do something before the deadline?
Well, I think you've heard the arguments here from Senator Graham and Senator Cassidy. It is better than the status quo by far. And I think that's an argument we're all comfortable with making.
Limited time left in the fiscal year, limited time left in the calendar year. How concerned are you about time in terms of getting everything you want to get done this year?
I think we'll be fine. Yeah. As you know, the next big priority is tax reform, and I think we're just fine.
Senator Black, there was an allusion made.
And this would go to Senator Graham, too. Senator Graham's raised a lot of concerns early on in the process about how this was working, how you were moving through. One of your colleagues and good friends has made this kind of the basis of a rather important vote in July. Given the compressed timetable, do you feel like you will adequately address Senator McCain's concerns?
We have a hearing scheduled Monday in Finance. We had one vote on the NDA, the defense bill. Why? Because Democrats objected to Tom Cotton's amendment. My friends on the other side love process when it advantages them. So there will be a public hearing, what John's been asking for. You can have different opinions about the quality of this bill. At the end of the day, this is the only process left available to stop a march towards socialism. We have between now and the end of the month to have a vote and a debate about whether this is better than the status quo. My friends on the other side are never going to agree to a bipartisan proposal that does anything other than prop up Obamacare. I've talked to the president 5 times in the last 2 days. He is focused like a laser. He has told me he's not going to throw good money after bad. He's very excited about this state-centric health care system. And all I can tell you is that the process left to us is that the Democratic Party is never going to give us anything that fundamentally changes Obamacare. We've had weeks of talking, and the only time they've gotten serious is when they're afraid that my bill may pass. And now they're coming to me, what about this and what about that? Here's what the Speaker of the House told me. I will not bring up a bill for a vote in the House that props up Obamacare because that is not why I came here and that is not what our majority wants to do. And the President of the United States is committed to repealing and replacing this bill, not propping it up.